21.4 Temperature. The body adapts in different ways according to the external temperature that then affects the internal temperature of the body. If the internal body temperature isn't at optimum level, which is 37 degrees, then this has serious consequences for the body's state that could result in the person needing to seek medical help, which I'll explain in more detail later in the presentation. The changes the body experiences when it's not at its normal temperature will have an effect on the person's sporting performance, which also I'll explain in more detail later in the presentation. However, a sporting example where people were cautious and took into account that the athlete's performances would be affected because of the temperature outside, because it was too hot, is at the 2014 Football World Cup that was held in Rio. So the games were rearranged for the evenings so that it was cool enough for the players to play so that they wouldn't overheat. Later in the presentation, I'll be explaining the experiment we did and how the different temperatures affected our results. Homeostasis is the process by which the body tries to keep the internal conditions constant. The receptors monitor what's going on in the body and try and keep equilibrium. And the receptors send messages to the brain. Then the brain passes these messages to the effectors, which respond and make the change, whether that be like secreting a hormone or causing a muscle to contract. The negative feedback loop is linked with homeostasis. It's essentially the automatic control system. So when conditions in the body increase or decrease, the negative feedback tries to control the conditions to bring it back to normal. There are different aspects that can change the body's internal temperature that can occur within the body or outside of the body. So heat input. So the body temperature rising can be caused by internal factors such as your body's metabolic process after eating, so the breaking down of foods. Also when your muscles contract during exercise, they give off heat. The external factors that influence the rise in temperature within the body are conduction, so heat from a hot object, and radiation that is emitted from every object. The body temperature decreasing can be caused by evaporation, so the evaporation of the water from your skin, which is also known as sweating. Conduction, but this time from cold objects touching the body, and radiation and convection, so hot air rising. The hypothalamus in the brain is the specific part that controls the body's internal temperature. But the thermoreceptors, so the peripheral, which are located on the skin, and the central, which are located in the brain, these receptors detect changes and try and counteract these changes. So if the body is too hot and needs to cool down, and vice versa, if the body is too cold and needs to warm up, then involuntary changes will occur. When the body is too hot, these receptors send signals to the thermoregulatory center in the hypothalamus. These signals then get transmitted down the sympathetic cholinergic neuron, which results in the message telling the body's blood vessels to vasodilate, or our sweat glands to secrete sweat. So then the water evaporates and we cool down. Also, our hairs on our skin flatten to allow heat to escape. When our blood vessels vasodilate, it means that they are expanding to allow more blood to flow through them, especially to flow to the skin so that heat can be lost. The precapillary sphincters that are connected to the arterioles and the capillaries relax, which allows the flow of blood through the arterioles to the skin surface, which results in the loss of heat. However, to try and retain heat because the internal body conditions are too cold, then the messages from the brain get sent down the sympathetic adrenergic neuron to increase the metabolic heat production and to vasoconstrict the blood vessels. Also, the messages get sent from the brain down the somatic motor neurons so that the body's muscles can contract. So they start to shiver and so that metabolic heat production increases. Also, our hairs on our skin stand up to trap the heat. This is known as piloerection. When our blood vessels constrict, it means that they decrease in dilation to stop the blood flowing to the skin so that heat isn't lost. The precapillary sphincters constrict, which allows little blood to flow through the arterioles, so this retains heat. In addition to this, there are voluntary ways that can help the body warm up or cool down. If we want to warm up, we could put an extra layer on or move around, so increase muscle contraction, or touch something that's warm. On the other hand, if we want to cool down, we could take a layer off or slow down, so less muscle contraction, or touch something that's cold. But if the body overheats or gets really cold, then this can affect someone's health, as certain illnesses can occur. Extreme condition when the internal body temperature is too hot. So the body temperature is severely above 37 degrees. The condition is known as hypothermia. This affects the body in many ways, where the person would experience an increase in heart rate, muscle cramps, sweating, thirst, fatigue, nausea, loss of consciousness, confusion, and could result in the person dying if not seen by paramedics and getting medical help. Also, a person could experience dehydration. Dehydration is extreme loss and lack of fluids within the body, which can result in confusion, loss of concentration, hallucinations, and could lead to heat stroke. In connection to this, the enzymes within the body can denature if the body's condition is too hot, which means chemical reactions that need to happen within the body are inhibited. In relation to someone's sport performance, if they are dehydrated or have hypothermia, then they are not going to perform to the best of their ability because they will be confused, will have a lack of concentration, which could result in them making poor decisions within a game situation. Their body and muscles would be competing for oxygenated blood, as oxygen is needed to help cool the body temperature, but also needed to help the muscles contract. Because of this, then the muscular capacity to contract will decline, and the athletes will start to fatigue. In contrast to this, when the internal body conditions are too low, this is known as hypothermia. The effects that hypothermia has on the body are that you start to shiver, get cold and pale skin, your speech is slurred, the breathing rate increases, and your heart rate lowers. Also, the enzymes denature, so won't work as well, and the person might experience confusion and they will be fatigued. And if the person does not seek medical help, then they could have a possible cardiac arrest. There are different stages of hypothermia, so acute or like immersion. So this is when you just like fall into ice cold water and you just feel cold. Secondly, exhaustion, so the contributing factors of falling in the water, but then your clothes being wet, and the outside being cold. And then finally, chronic hypothermia, which is progressively worse hypothermia, and you need to seek medical help right away because it could be very dangerous. The effect that hypothermia can have on a person's sporting performance are that they have poor coordination and are disorientated. So this could result in them making poor decisions or dangerous tackles in a game-like situation of football, for example. Also, their muscles and tendons could tear because they're not warm enough, so not stretched enough, which would result in them tearing, so having injuries. However, athletes could try and adapt to the cold and hot conditions before their events by training in an environmental chamber, because then their bodies can familiarise themselves with the surroundings, so that when it comes to their event, in the particular condition, then their bodies are prepared and knows how to react to the event.